So this session is about introduction and the prep for this program that's going to start in just a couple of days. So we've done the prayers. We're going to go into introductions at which everyone will get a chance to introduce yourselves. We've got to keep it to under 1 minute because we have a lot of folks here. I think we have 30 people here, so if you go more than a minute, it's going to take a long time. And then we're going to talk about getting ready for the program, the lab tests, the calendar, and we'll answer your questions. And then Dr. D will be covering a few topics. One of the important things is going to be for you, I think you've all logged into mybodysite.com. I've sent out the documents. I've been able to send it out as surveys, and you can just type in your name at the end to show your understanding of the agreements in the program, and I'll explain that in the course of today's session. And then we'll talk about the shopping, the lifestyle tracking, and the lab tests, and then we will cover. We'll review the calendar and answer your questions. And you all know that we're trying to get rid of your comorbidities, and that our paradigm is to deal with the cause of the diseases and not just deal with the diagnosis. So today we're here on the 9th. We're getting the introductory information. Just remember our next session is Friday. Just remember our labs, the lab slips will be sent out tomorrow, so you can go Friday or Saturday morning to get your blood test done, fasting before breakfast. And I think if you've had a blood test done in the last month or so, we can use that as your baseline. And just remember our next meeting is Friday evening to explain to you what you're going to be doing. We're going to be measuring the effect of your diet starting Saturday the 12th all the way up to the 22nd. So that's 10 days in between, so that you can see what happens when you follow a diet very carefully. By now, I think everyone has signed up to the website. So just remember that what we want you to do is enter your beginning weight, blood pressure. Those are the main things we want to enter. The blood sugar we can get from your lab slips. Now, if you already have diabetes and you have a finger stick, there's actually a place for you to enter that information so you can track it in a better way. You can also track your step counts and other. You can actually track your sleep and your calorie intake by nutrition analysis. It's actually a very robust website, and it looks like this. And of course, I think you've all already signed up to it. Let's see. I'm trying to. I can't get to. Oh, here we are. This is what your. I'll actually send you a link to a video on how this is used. One thing though that I would like you all to do is we've assigned you. I know you filled out the introductory survey. I'm having Ty send out 4 more surveys, and the surveys are just nothing more than the documents to sign, the agreement to the program agreement, the confidentiality agreement. There's actually a HIPAA form. The HIPAA is the Health Insurance Privacy and Accountability Act. because in some ways I'm your physician, I'm obligated to tell you that all of your data that we collect belongs to you. We can't let the information out without your signature, and you can access your information for the asking. And I've actually emailed to you we have it's actually a very complicated fourfold what we call privacy policy that says that the information is yours, that the information that we collect on you is yours, and we can't let it out except the exceptions, and there are many exceptions like criminal investigation, Medicaid fraud or Medicare fraud investigation, Homeland Security, etc. But please sign that you received the form and that we explained that to you. If you have questions, of course, ask me. There's also another form that's called a waiver of response. It's so that you know that I'm only a doctor for you for the duration and for the period of the program, and that's a form that's called a waiver, because I don't want any other your doctors to think I'm taking you away from them. Even those who join Club 120 still keep their primary care doctor, but I want the agreement that I'm not responsible for your primary care, that you have a primary care doctor, and that's your responsibility, and that once the program is over, then you basically go back to your regular doctor. So there's going to be 4 surveys, but they're just basically the agreements to sign, and all you do is just type your name and the date at the bottom, and it makes it much easier to sign fill these forms. And you've already done the introductory form and the health database. And confidentiality, I think you've all gotten you're supposed to have gotten confidentiality notices from all of your medical doctors. So this should not be anything new to you. The tracking, when you get on the body site, there's this place called Track. And you click there and you can track your food, track your activity, track your body. The food part is really interesting because when you type something in, you have a choice of what food you're looking at, because when you click on it, it'll actually give you a nutrition analysis, the fat, calories, and protein, the macronutrients. It's actually a very robust program. There's a couple of thousand foods there, so you can actually see the analysis of what you're eating. Tracking activity, basically, this is your blood pressure, systolic up here, diastolic down here. And as you make entries, these bars get narrower and narrower. Activity, that's your step count. Now, I would like everyone to try to keep a step count. I like to have people do at least 5,000, if not 10,000 steps per day. And, we'll try to encourage you to do those things, because this is not only about changing your diet, it's about changing your activity. And exercise is a lot more important than people ever thought. Now they realize that exercise keeps your brain healthy. And there's a study done that I just sent out to my Club 120 folks, saying that when people exercise, even when they have the pathology and the markers of Alzheimer's disease, they don't get the dementia. And it's really an interesting finding that exercise prevents that. And here's how you track your food. You have a place for breakfast, snack, lunch, snack, and dinner and snack. And when you type in the food, you'll see that a nutrition analysis will come up for it. I'll send you information about that later. In addition, we have lots of health and cooking videos for you to help you get started. And I'm going to talk. I think I'll turn it over to Dr. D, and then we'll talk about some of the um, supporting materials, and then after that we'll talk about the lab slips. All right, I'm going to now stop share and turn this back over to Dr. D and pause recording. I'm going to pause the recording.
Next one.
All right. We're going to now we have a lot of additional information. I actually try to, if you see these, I try to cut these up into short videos, less than 10 minutes. Most of them are less than 5 minutes to help you along. I just want to remind you why Dr. D is talking about environmental exposure, because that's the first column in the new paradigm of health, where eliminating environmental exposures are an important part of the program, and it's important to get information on that even before we start the diet. So that's why we have these topics. All right. We're going to be sending you shopping and cooking videos. We're going to talk about cooking healthy breakfasts, lunches, dinners. We also have over 100 health-related videos. You're going to get a menu every day. I'm planning to do it still one day before, because I think it might be confusing if we do it 2 days before. I'm still thinking about it, because but what I'm trying to do is I actually have a way to make shopping lists. So I'll send you the shopping lists ahead of time, but you'll get these menus. It's not as easy as it seems, because the menus are actually automated to come out one day at a time. So what I might be able to do is send you shopping lists ahead of time. But you will get a menu at least one day prior to when you're supposed to follow it. And I'll send you links to all the videos, the shopping, the cooking videos, and other topics. These are some of the videos that we have. The next one, I don't have my sound system up, but the cooking videos look something like this. Oh, actually, is the sound coming out? Yeah, it is coming out. Can you hear it? It's funny because I can hear it. Anyway, I guess you all can't hear it. Okay. All right. Now let's go to the lab tests. Now this is really important. I think Ty has been collecting all of the information on where you want your lab tests done. If you had a blood sugar, see, we're following glucose and lipid profile. And the reason we're following those two is because that's really basically what we can change in 10 days. And if you've had a recent lipid and glucose done within the next month, we can use that as the baseline. But Ty will be sending the lab slips to your, I think you indicated which clinical lab is your choice, including on Maui. And it's Clinical Labs of Hawaii, not DLS. I just want to emphasize that, because if your lab is not covered by your insurance, we're going to try to bill your insurance first if it's appropriate. And if it's not appropriate, we have a deal with clinical labs to cover the cost at a discount, but you have to go to a clinical lab uh, if you are going to do the blood test based on our lab request. Again, if you have from your own doctor a lab test done within the last month or so, we can use that as the baseline. And Ty might be in contact with you in regard to that. Now, you have to get your blood test done Friday morning or Saturday morning before breakfast. In other words, fasting. And by the way, you can opt out of the blood test. It's for your benefit. But you should get your blood test done Friday morning or Saturday morning fasting. Ideally, it's a 10-hour fast. In other words, for example, if you have dinner at 8, 10-hour, and then you do the blood test at 6, that should be 10 hours. A minimum is 8 hours. If you have, if it's 8 hours, that should be okay also. So if you take a 10 o'clock midnight snack or 11 o'clock, and then you go at 7 in the morning, that should still be okay. But no food in the morning before your blood test. And if you have questions, you can reach me at Dr. Shintani at protonmail.com. I'll actually send you a link to Ty. My personal phone number, I will send you in an email, 255-1696. Do not share this with others, because if random people call me, I may be tied up when you want me to call you, when you want to call me. So that's how it is. So just remember, tomorrow, Ty is going to arrange for your lab slips to be sent to the location of your choice. All right. And then you do your blood test on Friday or Saturday. All right. And again, we're here today. We send the labs out here tomorrow, and you do your blood test either Friday or Saturday morning. Okay, I'm going to turn this back over to Dr. D and stop here. And after this, we'll do question and answer. I think I'm pretty much done with my slides. Wait, the main thing is you remember that our next meeting is Friday, but just remember, lab slips are going to go out to the clinical labs of your choice. If you don't have a lab that we can use as a baseline, I think a couple of you may be getting yours done at Kaiser, but talk to Ty about if you need to. He'll be communicating with you where your labs will be sent, and you do your blood test Friday morning or Saturday morning fasting, and then our next meeting is Friday at 7. All right, I'm going to now just open it up for questions about any of this. Oh, and by the way, just remember to go to your body site and look at the documents, sign them. If you have questions about it before you sign, of course, just ask me. I don't want you to sign something you're not comfortable with. But those are standard. Those are standard forms that everybody signed out of our couple of thousand previous participants. So let me just turn it over. You can either type it in your chat or unmute yourself and just say, I have a question, and state your name and state your question about any of these topics. Okay.
Hi, this is Jonah Moai. Can you hear me?
Hi. Yeah, I can hear you. What's your question?
Okay, I'm a Kaiser member, and it seems like the labs aren't open on Saturday morning, and that's the only time I can take it, because I can't fast and work at the same time, I think, because I feel weak. But I was wondering, is it okay to use that lab slip at the clinical labs of my choosing, and have it, I guess, being taken care of by you guys?
Yeah, if there's no other way to do it, then we'll cover it. Yeah.
Okay.
He can go on tomorrow or Friday.
Yeah, but you have to do it on, it's going to go out tomorrow you have to tell them which lab to send it to.
Oh, okay. Yes. I'll message Ty the location of the clinical
Right.
labs.
Okay. All right.
Yeah.
Okay. All right.
Thank
How
you.
long
Okay.
will the body site be available to us?
Okay. How long is the body site available to you? It'll be available during the program, and I think we go to the end of the month. It's actually a benefit of the Club 120 Plus.
End of March?
End of February. Yeah, it's
What
just
type of supplements?
Yeah, so I don't know if they heard the question, but the question was, how long is the body site available? And it's actually a benefit of Club 120 Plus. So if you join, of course, then you'll have it, as long as you're a member. But for this program, it goes to the end of the month.
What type of supplements?
Okay, what about supplements?
For this program?
Yeah, so the supplements are actually individualized, but for the most part, I want people to be protected from COVID. So I actually have a COVID supplement protocol. For some of you, some of the supplements are a little bit more important. If you've got cancer, they say vitamin D looks like it works for most cancers. So for people who have cancer, you might want to see what your vitamin D level is like. I know if you're a member, then we can arrange for that. Otherwise, you can actually ask for it, but you have to pay for it out of pocket for your vitamin D levels. But to some extent, it's individualized, in terms of your supplements. Any other questions?
How much does the Club 120 membership cost?
The Club 120 membership is actually, I don't like the term. They call it like a concierge practice. I don't really like that term. It's a membership practice. Club 120 I take about 120 patients. It's a limited practice. I have a handful of slots available. It's basically $2,000 a year. And if it's a husband and wife, there's a discount of about $300. And what that does is it gives you extra access to me. We'll talk about it at the end. But you have my phone number, you have my email address. You can ask me questions anytime. I send out a message every day to support your health. And when you see me, we do it under your insurance, but your visits are much longer. It's the visits are at least half an hour long. So, but we'll talk about that at the end, right? Any other questions? If you have a question, you can just unmute yourself and state your question.
Same with, no, I'm sorry.
Hi. Anyone?
I have a question.
Yeah, who is this?
Oh, Debbie?
Yeah. Debbie, yes?
Yeah. When do we start all the tracking? Do we start doing that Friday?
Good question.
Yeah, actually, ideally, excuse me, ideally the baseline is Saturday morning fasting. So ideally you get your weight Saturday morning before breakfast, your blood pressure. If you have, it's ideally you'll have you get a blood pressure cuff of your own to monitor yourself. Nowadays, they're not very expensive. They're like about $30 at Long's. And the blood pressure cuffs, the automated ones, are actually really good now. And track your blood pressure. Put it in the My Body site tracking. But the official beginning should be first thing of Saturday morning.
Okay. And one more really quick question. The forms we have to sign, do we print them out and sign them and then
No. You don't have to print them out. It's in the form of a survey, and at the bottom of the survey, I say, if you agree, just type your name in and the date, and that'll serve as your signature.
Okay, thank you.
Yeah, I think that makes it easier for everyone. The last programs, we had to print them out, and some people don't have a printer, and some people don't have the ability to email it back, so they mail it back by snail mail. But it looks like I know that I figured out how to send the form in the form of surveys. So in your box, it should say you should have 4 surveys that Ty has sent out to everybody, and each of them has one of the documents that we discussed, and then right at the bottom you just type your name and your date, and that's your signature. Makes it much easier. Nobody has to print anything out. Nobody has to mail anything in.
Good.
Okay.
Kuchi had good information. All longs and other, hang on.
Okay, somebody is saying
All longs and other pharmacies are giving 3 N95 masks free.
Okay.
Part of the federal program.
Okay. Thank you, Kuchi. She says that it looks like all longs and I guess Walgreens?
All pharmacies
are giving out 3 N95 masks for free, just for the asking. So thank you very much.
Okay. This person wants to know if they take their blood pressure before or after taking their meds.
No, that's a great question. You should take it up. You should take your blood pressure in the morning before you take your medication. We want to see what it is when you wake up. Ideally. Yeah.
So starting Saturday morning, we do that.
Yeah, you start on Saturday morning, and then you redo it on the Tuesday after 10 days, so that it brackets 10 days. Ideally, we would bracket 10 days exactly. I know it's hard. I know for some people they have some challenges doing that, but ideally, we would do it that way so that we have an idea of what's happening within 10 days. The reason we do 10 days is that Dr. D and I have been doing 10-day programs, since, 2007. We've done thousands of people. And so it's good to compare the results. And actually, we've already seen the results. They're almost the same as we did when we were meeting in person. So we know that we're getting a pretty good idea that this actually works quite well. Yeah.
I have another question. Sorry, can you hear me?
Yeah, I can hear you. What's the question?
The question is pertains to the blood pressure. So this is Melissa, by the way. I've had a lot of my lymph nodes taken out. So there's only a certain spot in my body that they allow for blood pressure taking. And I know that the numbers are off.
Yeah.
I have to do it on my cuff of my arm. So Is that okay? Yeah,
that's okay. Whatever, if you need to get it from, they now have wrist blood pressure cuffs. They're not quite as accurate, but still pretty good. So you'll get an idea of how it is. Yeah.
Okay.
Whatever blood pressure number you can get.
Okay. You should stop recording.
Oh yeah. Actually, we should stop recording. All right.
Must be one of those she must be the one with stage 4 breast cancer.
Yes.